Good to go.
All right. Hi, welcome everybody to our live Q&A. We have two special guests here today with us to answer all of your questions about kids and COVID. We have Dr. Catherine Leisinger and Dr. David Higgins, both here as part of the Montana chapter of the American Academy of Pediatrics, and bringing with them a bunch of experience and wisdom. And we have a bunch of questions to get through. Before we get started, though, I'm just going to give each of them a second to introduce themselves. Dr. Higgins, do you want to go first?
Yeah, sure. I'd love to. Thanks, Sarah. So my name's Dr. David Higgins. I am a former Billings pediatrician doing an advanced training program now, actually in public health and preventive medicine, learning how to take care of populations of kids and not only individual patients. And I've had the privilege of working with the Montana AAP since the beginning of the COVID pandemic and working to try and keep our kids in Montana as healthy as possible.
Thanks so much for being here, and thanks for all you do. Dr. Leisinger, do you want to introduce yourself quickly?
Sure. I am a former colleague of Dr. Higgins. We used to work together when he was here in Billings, but I'm in Billings and working in a busy general pediatric practice, outpatient, doing both sick and well kids, lots of vaccines.
Thank you so much for being here today. We really appreciate it. So we have a bunch of questions to get through. Let's just jump right in. Our first question is one we've been hearing a lot about, which is, what is the latest update on vaccines for our youngest kiddos who haven't been vaccinated yet? And also kind of going off that, what advice do you have for parents who are still waiting on that vaccine? Why don't we start with Dr. Leisinger for that one?
Sure. So I know that as a parent who had to anxiously wait for my 11-year-old to get vaccinated, it's very hard to continue waiting for those youngest ones. Right now, we have approval for 5 and above, and we're anxiously waiting for kids that would be 4 to 6 months. Unfortunately, there was a little bit of a delay. We were hopeful that we would be vaccinating by now. And the study, when they reviewed, and we're still waiting on a little more information, but the youngest kids, the 3 to 4-year-olds, didn't have quite the robust response that they wanted to see. And so they took it back to the study group and looking for some more information, collecting more information. The releases they've sent out, it looks like the 6-month to 2-year-olds had a good response. They're testing a very low dose vaccine. So the 5 to 11 is 10 micrograms, and this is 3 micrograms, and adults are 30 micrograms. So this is quite low dose. And so it's exciting that the youngest responded so well, but we're still collecting information on those 3 to 4-year-olds. They are submitting to the FDA, which we'll likely review next week, for approval of those doses, with the hope that, one, they'll release some more information so we can know exactly what they mean by not completely responding, and that at least we can start vaccinating initially, even if maybe those 3 and 4-year-olds need a 3rd dose. That's what still needs to be decided. And as far as waiting, I know it's very tough to wait, but continuing all these mitigation measures that we have talked about for the last 2 years, significant things have not changed. I know it feels like it's changing, but avoiding crowds, masking when you're in crowds, lots of hand washing, and staying home when you're sick, and then testing if you feel either you or your child are ill. And then significantly, we have found that kids who live in households where their parents are vaccinated, it actually decreases their risk. So if you can get everybody around that child who's eligible to be vaccinated, it helps protect the unvaccinated child.
That is really, really good to know. Dr. Higgins, do you have anything to add to that?
When I am talking to parents and trying to explain some of this confusion about the vaccine in under 5-year-olds, and the things you read in the news, right? That Pfizer said, oh, okay, we're going to get more data. The FDA asked Pfizer to get more data, and then now they're submitting. It can all seem really confusing to parents. And most people don't understand the really complicated process that we have for vaccine approval. What I do try to emphasize with people and help them understand is that this is actually, although it's frustrating, especially if you're like me and have a little one who's under that age and I really want to get her vaccinated, although it's frustrating, it's an example of just how thorough and robust our system is for approving vaccines. Arguably, vaccines are put through more rigorous safety and effectiveness studies and evaluation than any other thing in medicine. And so while it's frustrating, I really think that it shows just how much we care about making sure that the vaccines are safe and effective. And I look forward to the next couple of weeks seeing what the FDA and as well as the ACIP decide, and as they look at the data. I'm hopeful that we will continue to see what we've seen in 5 and above, is that this is an extremely safe vaccine that prevents horrible disease and even death. And I expect that we'll see that, but we're going to have to stay tuned over the next couple of weeks.
That's a great way to think about it. So over the last couple of months, I guess, there have been a really large number of kids who've gotten COVID in this last sort of spike. How long do you have to wait to get your kids vaccinated if they have had COVID, or how long is optimal? Let's give that one back to Dr. Higgins.
Yeah, sure. So that's a great question. And there's a lot of confusion. And part of the confusion is that there is this window that everybody's talked about for about 90 days where we think it's relatively unlikely that you're going to get reinfected. And so what I'm hearing from a lot of families is, oh, I should wait. Somebody told me I should wait 90 days after my child has COVID-19 to get them vaccinated. And there's no truth to that, okay? We really recommend that once your child is through their COVID-19 infection, meaning their symptoms have resolved and they're better, as soon as that is done, that's the appropriate time where you can go and get them vaccinated.
Great. Dr. Leisinger, do you have anything to add there?
So I would just add that there's a couple of circumstances where it is appropriate to wait. So I totally agree. As soon as you're healthy, get that vaccine. But kids who had the multi-system inflammatory disease, which is a really unfortunate complication, although rare, those kids can be quite ill. And it is recommended that they wait 90 days before vaccination. And any child who fell into a high-risk category that then received the monoclonal antibodies should also wait 90 days. But that's a very small subset of kids, and everybody else should get vaccinated. The other question we get a lot is, I got one vaccine, then I got COVID. Do I have to wait? What happens if there's a delay? Get it as soon as you're out of your isolation. Even if that's a little longer than the 3-week recommended, just get it as soon as you're out of isolation and it's completely safe.
That's great to know. Okay, our next question is, why does the MTAAP recommend masking for kids over 2 years old? Is there a type of mask that you recommend for kids? Let's give this one back to Dr. Leisinger.
So the important question about masking is, pick the mask that the child will wear. And that can be a challenge on young kids. We know that 2 and above, it's very safe to wear a mask, and it does an incredible job of helping prevent disease. It also helps protect the wearer if they wear it. And that's the important thing, is finding the safest mask, the best fitting mask, because all masks are safe, but you're trying to find the best fitting mask. And the cloth masks, the gaiters, the single layer, probably not the best. That's what we used early on. They're better than nothing, but we really do have better masks now. And finding a good quality multi-layered mask that covers mouth and nose and that they feel comfortable in wearing, that's by far your most important mask.
Dr. Higgins, do you have any insight?
Yeah, I completely agree that finding a comfortable fitting mask, but the one that maybe provides a little bit more protection. We do have that building data that the thinner the mask, the type of mask does have a different level of protection. But at the same time, I'm always talking to families about the fact that if their child is uncomfortable in a mask, even if it's a better material and they only wear it 50% of the time because they're so uncomfortable, well, that's not going to be as effective either. So I think you have to think about the practicality of the mask and make sure it's one that they're comfortable wearing for extended periods.
Great, thank you. The next question is something that I am really looking forward to knowing the answer to. I think a lot of parents right now are getting a lot of notifications from school when their kid is exposed to COVID in the classroom. And I don't know what to do when that happens. I don't know what are the optimal ways to act or the steps to take to keep everybody safe, my kid and other people's kids and families. What should you do when you get one of these notifications? And I'll give that back to Dr. Higgins.
Yeah, that's a great question. And I'm a parent myself and have had these same notifications sent to me. And first, I want to say it's important that you are checking in with your school, checking in with what your local public health departments is saying, okay? And then also checking in with some of the national guidelines on quarantine from places like the CDC, all right? And so it's important because they may have things that are different and expectations and protocols that are slightly different and nuanced, but in general, the first important decision point is whether your child's vaccinated or not. We do know that if your child's vaccinated, that lowers the risk that they were infected with COVID-19 and then could pass it on to somebody else. Does it eliminate the risk? No. And so even if your child's vaccinated, it's very important that you're doing some of the mitigation measures that we call them that we've been recommending this entire time, including masking. Okay, and so it's so important, even if your school has dropped masks, even if you haven't been masking routinely in some places, it's so important that if your child was exposed, that they're wearing a mask. Okay, we recommend wearing a mask for 10 days for that time period where they could be spreading the virus and not even know it, or be on the verge of developing symptoms and spreading the virus. Okay, so that's really important. I think the second thing that's really important is that it doesn't matter if your child's vaccinated or not. In those 10 days, if they get any symptoms of COVID-19, it is so important to take that seriously, that this absolutely, your child absolutely needs to get tested, okay? And I say that because I still see a lot of families and I see a lot of kids with COVID-19 that have very mild symptoms, right? And I hear frequently, oh, I can't believe this is COVID-19 because they just had a runny nose. They woke up and they coughed 2 or 3 times and that's it. Those symptoms are so important, especially if your child's in that what we call quarantine period where they've been exposed, to take those seriously and get them tested if they have any symptoms. Okay. And then also there's some recommendations around having your kid just routinely tested after being exposed, depending on testing availability. Okay. And those I think are important things to check in with the CDC or your local public health department. And some schools can direct you as well to where you can get tested, even if they don't have any symptoms, to make sure not only that they're keeping the school safe, but also your family and others that you might be around, okay? And the last thing I'll say is if your child's not vaccinated, all of those things are true, but they need to be taken even more seriously, okay? So if your child's not vaccinated, that is where the CDC says, okay, they really should be staying home and avoiding others during that period, because especially, as the COVID variants have progressed from the originals to the Delta wave to the Omicron wave, it is extremely contagious, okay, extremely contagious. So it's so important that you are following those things, masking, staying away from others, especially high-risk individuals during that period, testing, and taking seriously any symptoms that they develop.
That's really great to know. Dr. Leisinger, do you have anything to add?
I would just echo, as a working mom, I understand how difficult this is, because we really it becomes noise in the background when you get all of these notifications, and sometimes 2 or 3 a day. I have a child in middle school, big middle school. And so he would constantly get these notifications. And Pre-COVID, I was guilty as anybody, sending the kid off with a little runny nose. He'll be fine. I got to go to work. And we just can't do that. And so, especially if you've been exposed, but just knowing right now in Montana, we still have an extremely high burden of disease. And so, even if you haven't gotten those notifications, if your kid is showing any signs of illness, even if it's very mild, you really do need to take that seriously. And I actually have one at home awaiting a test for a little sore throat she woke up with today that normally we probably would have ignored. And you just can't do that because the risk is too great to those more vulnerable kids, those more vulnerable people in the community.
Yeah, Dr. Leisinger, I think that's such a great point that you make, that it's still so widespread. And I know we're all excited that, okay, maybe things are starting to look better, but it's still so widespread that if your child gets any symptoms right now, you have to assume that probably within the last 10 to 14 days, they could have been exposed to somebody and you might not have gotten a notification. So it's so important to take that seriously and have them tested right now.
Great, thank you. We just had a question come in from a listener. How do you talk to your kids about COVID? I guess you personally, as well as COVID safety measures, especially given how many adults in their lives have different opinions on what is best. Dr. Leisinger, let's start with you.
So I think just being open and honest about kids, they want to know information. They know there's something big going on. They hear it on the news, they hear it from people, and it's much better for you to be honest with your kids and talk about some of the reasons that we're doing what we have to do. And especially my kids being the kids of pediatricians, we have been extra cautious. And so they've missed birthday parties, they've missed special sporting events. And so really recognizing that this has been hard on kids, but if they understand why, my kids are very, they can talk a lot about the spread of COVID. They can talk about masking. They point out when other people aren't masking because they understand that it's not just protecting them, it's protecting other people. We didn't see grandparents for a long time until they were vaccinated. And so if you talk about the reasons that you do some of these measures, and it's gives a very good lesson then beyond just COVID, that we're trying to protect not just ourselves, but other people. And that it's something that we think about as a community, a gift that we're giving to the community by being extra cautious about COVID and not spreading it to other people. But I really think being honest with kids is by far the most important thing. They want to know, why are we doing this?
Dr. Higgins?
Yeah, I can't reiterate that enough. It's so important. Kids pick up way more than we think that they do. And not talking to them about it or trying to hide it, it makes it worse in their mind, right? That fear of the unknown. And so I agree. I think it's really important to welcome their questions, to create space for them to ask questions, to create space for them to share their anxieties or fears. Okay, whatever that may be, and do it in a developmentally appropriate way, right? You're going to have a different conversation with your 2-year-old than your 12-year-old, right? But all those things I think are so important. And you know, I think it's important to when you address those fears with your children, whatever the fears may be reassuring. And focus on what you are doing as a family to stay safe, what your expectations are as a family to stay safe. And I think it's okay to talk about how other families, other adults may have a different opinion about how they want to stay safe. But this is what we're doing in our family to help keep you safe and to help keep the rest of our family safe.
I love the idea of creating space for them to both ask questions and talk about how they're feeling. All right, let's see. Dr. Higgins, you mentioned earlier that COVID in kids is often much milder or presents in a milder way. It could just be the sniffles or a cough. What should parents be looking out for when we're worried about COVID or wondering if we should test or keep them home from school?
Yeah, that's a great question. And I always like to clarify one thing when I talk about COVID often presents mild in children. COVID is not always a mild disease in children, right? And that is why we're doing everything that we're doing. Unfortunately, it has resulted in thousands and thousands of kids being hospitalized, Okay, we have seen many kids that unfortunately have died, and we're continuing to learn more about things like MISC, as Dr. Leisinger said, as well as long COVID in kids, right? And so, but a lot of kids are presenting with pretty mild symptoms. And so the things that I think are important to look for, and unfortunately, these symptoms, they overlap with influenza, they overlap with other, what we call as pediatricians, upper respiratory viruses, like the common cold. They completely overlap. There really is no way to see your kid's symptoms and think, oh, well, that's not COVID. That looks more like one of these other viruses. Unfortunately, there's not a way to do that. Okay, so the things that I'd be looking out for fever, any cough, okay? You know, when you see fatigue, I don't mean, okay, you stayed up a little bit late. I mean, like, all right, they're not wanting to do their normal activities. That's how I always judge fatigue, right? Typically they're running around with their friends and, you know, I just want to lay on the couch. I don't want to do the fun things that I typically like to do. Okay. You know, headaches, body aches, sore throat is a big one. And then congestion, runny nose, right? And again, we're looking here for, okay, you know, some kids kind of have a runny nose the entire winter. I'm looking for, they woke up and it's clearly different this morning, right? They had just little sniffles all winter. They woke up this morning and there's a lot more there. Okay, so those are a lot of the things that I'm looking for. Also, nausea, vomiting, diarrhea. Those are all reasons why you should keep your kid home from school even before COVID, right? But those are all things to be looking out for as far as symptoms. And they may have one of those things. They may have multiple of those things. If there's ever any question, I really encourage parents to reach out to their pediatrician or their PCP, at least by phone, and say, hey, you know, they've got these symptoms. What do we need to do about it?
Dr. Leisinger, do you have anything to add?
I think that's great, because that's been the frustration of COVID, is that for us as physicians, it can present very mild. And how do you detect that? And then on the other hand, we can talk about, your kid has tested positive. What should we look for? When should you be worried? And some of those things that we look for, prolonged fevers. So fever should resolve in 5 days. And if it goes beyond that, we definitely need to see them. Fever's common, and even sometimes higher fevers. But if they are still eating and drinking and for the most part doing okay, we don't worry so much about the fevers. But if they quit drinking and you're worried about dehydration, we need to see them. We also worry if they're having trouble breathing. So sometimes they can have a cough, but if you start to notice more than just a typical cough and they're working hard to breathe, they can't eat or drink because they're having to work so hard, those are things that we need to see. And that would be for any respiratory illness. A lot of times flu or RSV can be the same way, but those are what we're looking for illness. And then maybe they've recovered from COVID, they're doing great, and they start to present with looking very ill, quite sick, high fevers. That's when we start to worry about that inflammatory disease. It typically presents weeks after infection. Sometimes you don't even know that the child was exposed, but certainly if you have an exposure and the child is acting very very unwell, especially with high fevers, that would be another reason to be evaluated.
That's great to know. Thank you for going over that list. We have another question that just came in. How do you think about risk, like deciding whether to have your kids go to a birthday party? How do you figure it out? There's probably not a super cut and dry answer to this, but we'd love input. Dr. Leisinger?
So yeah, that is definitely, as parents, that's been the last 2 years of our lives, trying to figure out when is something safe. I think there's a couple of different factors that you can take into consideration. One, the complications or medical risk of people that your children are around. If they themselves have high risk medical conditions, you're going to be much more cautious than you would be that if they're maybe healthy. If they're at higher risk for complications, you definitely would be more cautious. Or if they are around people that are high risk, if parents or grandparents that they spend a significant amount of time with are high risk, you're going to look at it differently than if they have no other risk factors. And then looking at a combination of when we're in surges. So it's it's difficult. We've not really defined when low spread, but we can definitely feel when things are getting much better. And looking at hospital capacity is sometimes something that we can measure. If the hospitals are full and they're sending out these, you see the newspaper articles that we're understaffed and there might not be beds, that's probably a time we all need to step back and be more cautious and avoid the crowds, avoid the public places that you're going to be at higher risk. But as things get better and maybe your kids are all vaccinated, that makes a big difference. And that's why the struggle and why we're waiting so much for those kids less than 5 is once they're vaccinated, vaccines do an incredible job of decreasing your risk of hospitalizations and death for all people in all ages. And so once everybody in their life is vaccinated and they themselves are vaccinated, you really can start to loosen some of those restrictions, especially as the disease burden in the community starts to decrease.
Dr. Higgins?
I completely agree with all that. This has been so challenging for us as parents and us as pediatricians trying to, walk alongside parents in these tough decisions that have changed a lot over the past 2 years. Yeah, the risk has changed based on all the things that Dr. Leisinger talked about, and kind of our tolerance for risk has changed as well. And as we've all tried to navigate the people in our lives, whether that's, your child's classmates at the birthday party, or whether that's family members, we have all had to navigate how do we get together and do activities with people that may have a different opinion about how to protect themselves and others from COVID. And so it's been a challenge, but I think everything Dr. Leisinger said is spot on there.
Great. Okay, here's a quick one. Does the color of a kid's runny nose make a difference in deciding whether it's COVID or not? Like, I guess clear versus that neon green color you sometimes see. Who wants to take that? Dr. Higgins, why don't you just?
Yeah, sure. I mean, so this is an age-old question that predates COVID, right? That pediatricians have been trying to answer for probably centuries now, right? So there is not any way to tell from the color of the snot whether it's COVID or not. And there's also not a way to tell from the color of the snot whether your child has some other virus or not. We all would like to think that that's the case. And I wish that's the case. That would make it a little bit easier. But unfortunately, that's not the case.
I'll stop looking then. Right. All right, we have time for one more question. This one just came in too. This is a pretty general question about testing. How to use home tests, when to use them. I know there's a lot of worry that home tests won't catch it, especially this latest strain. What are your thoughts on home testing? Dr. Leisinger?
So I think it's fantastic that the availability of these home tests, quick and easy. It'd be nice if they're a little cheaper, but they're getting much cheaper, that are so available, which we didn't used to have. And in the beginning, we would wait days or a week for testing. So this is much, much better. And it's very exciting, but it is sometimes confusing to know how do we use these tests. The home tests are antigen tests, and they work a little different than the PCR tests that we talk about. A lot of the hospitals and bigger centers are using PCR testing. The state uses PCR testing, and that's the gold standard. That picks up small amounts of virus, and that will definitely tell you whether you have COVID or not. These antigen tests are very rapid and can be very useful. The difference with these antigen tests is they sometimes can be inaccurate if used just once. And especially with Omicron, if they're only used at the very, very beginning. We know that a person could have COVID early on day 1 or 2 of symptoms and still test negative on those antigen tests. If you test positive on an antigen test, believe it, it's real. And we really do need to take that seriously, because they're accurate for being positive. But if you have symptoms, especially if you were exposed and you're a high-risk person and you have just one negative home test, that's not enough to say that you're not infectious. And so parents could find a PCR test that would be more of a gold standard, that if you have symptoms, you've been exposed, a PCR test is much more accurate, or use it in serial testing, meaning that you test one day, patient still stays home, your kid's home, they've got a runny nose, they've got a cough, they test negative the first day, and within 48 hours, you test them again. If you have 2 negative tests, you can be much more reassured that those tests are accurate. And that's why they're sold in 2s. They were not meant to share amongst 2 kids. They were meant to use on the same person 2 days apart.
Wow, that just gave me so much clarity. Thank you. That was very helpful. Okay, we're at time. I just want to take one moment to thank both of you, both for the work that you do every day with our kids, and also for giving your time to us and helping educate everybody at events like these. It means a lot. Thank you so much. Thanks for listening, everybody who came. This video will be available and posted, so you can come back and watch it or share it later on. I'm not quite sure when. All right, thank you for joining us.
Thank you.
Thank you.
All right, I got you guys stopped on the live stream. I didn't hear, I stopped it right after Sarah. So we don't hear you guys saying thank you, but it's good.
That's
All
fine.
right, stop.